Shall we continue to acknowledge and celebrate his arrival, His Excellency, the Governor of Akwa Ibom State. Such a lovable gentleman. I'll come to you. For us in Akwa Ibom State, we seize every opportunity that we have to celebrate God for the gift of His Excellency, Pastor Moino. Thank you, the brass band. Thank you, the brass band. Please, for us to get started, we will take the national anthem. The anthem, please. The Akwa Ibom State Anthem. Just rise, Akwa Ibom State. Thank you very much. Your Excellency, please, I'll crave for indulgence to remain standing as I welcome Elder Dr. Akpan to please come lead us on the opening prayers, please.
Your Excellency, please may we remove our caps. as we honor God in prayer. Oh, Father, our God, today our hearts are filled with eternal gratitude to you for what you have done in our dear state today. Today we have gathered together to stand strong with our governor, who has shown deep commitment in the health sector of our people, attending to the needs of the most vulnerable members of the Akwa Ibom state. Today again, our Father, we thank you for the gift of a governor who has shown and demonstrated deep commitment. And today we have come to celebrate the launch of this great scheme, in addition to the numerous projects that he has accomplished in the health sector of our state. We thank you. We thank you for the leadership of this state. We thank you for all the people that you've given to work with him. We thank you for where we are going as a state, that we are in the right trajectory, the trajectory of progress and development. Even as we commit this event into your hand, O God, we invite you to take preeminence. We invite you to continue to guide and ensure the overall success of this event. This and more we pray in the mighty name of Jesus. Amen.
Thank you so much, Your Excellency, and all the distinguished personalities who are here. I welcome all of us, including those who just chanted that beautiful welcome for His Excellency the Governor. But perhaps I just set the tone and mention that this event is a semi-formal event, and to that extent, all items and all chants should be very largely moderated. Your Excellency, as our custom is, we are here to launch the Akwa Ibom State Health Insurance Scheme, tagged ARISECare rather, which is yet another project that demonstrates the love that His Excellency, the Governor of Akwa Ibom State, and his government have for the people of Akwa Ibom State. There is no more any doubt that if today in Nigeria we're looking for a human personification for the word compassion, the only fitting man or leader for that is His Excellency Pastor Umoino. I want to therefore invite all of us to welcome and celebrate that leader that has shown love to Akwa Ibom people, His Excellency Pastor Umoino, Governor of Akwa Ibom State. Thank you so much. Very quickly now, I want to acknowledge, please can the protocol team help me behind? We want a moderated event, thank you. Let me acknowledge the Deputy Governor of Akwa Ibom State, distinguished Senator Dr. Mrs. Akwa. We celebrate and welcome you, ma'am, thank you very much. I acknowledge very respectfully the chairman of the People's Democratic Party here in Akwa Ibom State, Elder Aniekan Akpan. We welcome you. Thank you very much for joining us. Let me acknowledge and welcome respectfully members of the National Assembly who have joined us here this afternoon for this very strategic engagement. I welcome distinguished Senator Emmanuel Liboresien, distinguished Senator Effiong Bob and wife. I acknowledge both of them on behalf of all the members of the red chambers of the National Assembly, and for the green chambers, I acknowledge, please, on behalf of all the others who are here, the Right Honorable Onofiok Liuk. Let me acknowledge and welcome members of the Akwa Ibom State House of Assembly who have joined His Excellency for this very important event. We thank and welcome all of you. Wife of the former Governor of Akwa Ibom State, Mrs. Fumi Idonga-Senkanga, we acknowledge and welcome your presence here. I acknowledge respectfully the Secretary to the Government of Akwa Ibom State, Prince Enobongwa, the head of the civil service who's also here, Elder Effiong Isien, We thank you and we welcome you. Let me acknowledge all commissioners who are here. The Dean College of Commissioners on their behalf, Samonde Ebonguko, for not forgetting to acknowledge very respectfully the Commissioner in charge of the Ministry of Health in Akwa Ibom State, Professor Augustine Umo. Please can we put our hands together and celebrate him. Thank you so much. We acknowledge you. Thank you so much. Let me acknowledge Your Excellency, the Director General of the National Health Insurance Authority, who has joined us here at this event today. We acknowledge you, Dr. Kelechi Ohiri. Welcome, thank you very much. I acknowledge the chairman of our own health insurance agency. We thank you and we celebrate you, who's also the senior special assistant to the governor on health insurance, Dr. Edikan Ekwere. We acknowledge and celebrate you. Please, on behalf of all the other members of that agency, I acknowledge the secretary, Dr. Igbemi. Thank you so much. And I trust that you understand that that protocol had to be punctuated there for want of time. I acknowledge all permanent secretaries, heads of extra ministerial departments, chairmen of boards, and their members. Your Excellency, this afternoon, of course, being a health-conscious event, we have lots of professionals in the health sector who have joined us at this event. I'll attempt to take just a few for want of time. Of course, the Nigerian Medical Association, the NMA, is here. I acknowledge their chairman, Dr. Aniekan Peters. Please, can we put our hands together and celebrate him? Thank you very much. Let me also acknowledge the chairman of the Pharmaceutical Society of Nigeria, Akwa Ibom State Council. We acknowledge pharmacist Abasema Uwat, who is also here. We acknowledge and welcome you. The chairman, Association of Hospital and Administrative Pharmacists of Nigeria, Akwa Ibom State, who is also present. Pharmacy Honorable Nene Udom. Please, we acknowledge and welcome all of you, and we celebrate you very specially. Your Excellency, some of our sons, some of our daughters have joined us at this event from the United States of America. Let me acknowledge very specially the mayor and council president of the city of Upper Arlington, who has also joined us here. Please, can we put our hands together and celebrate Ukeme Wagasi Jetta, who is here in person. We acknowledge and welcome you, and we acknowledge you. Thank you so much. Let me also acknowledge the international president of Akisan, who has also joined us at this event, seated there. We acknowledge and welcome you, Dr. Mbong Ekiko. Please, can we put our hands together and celebrate him? Of course, he is here with the director of protocol of that reputable organization. We welcome you, Obongawan Inyobong Ikbe. Thank you so much for joining us at this event. Your Excellency, let me acknowledge all security commanders who have joined us here, all of them, please. Time would fail me to begin to read out all the names. We acknowledge and we welcome all of you. Your Excellency, our elders are here, our men are here, our youths are here, chairmen of local government transition committees, all of them who are here. I acknowledge them, please, through the chairman of Algon, Inyobong Robson. Please, we acknowledge you and we celebrate you so profoundly. Your Excellency, because we do not have all the times, I beg to punctuate today on the introductions as I acknowledge all our guests who have joined His Excellency for this very important event. We celebrate you, we honor you, captains of industries, the partners who have partnered with the Akwa Ibom State government for this launch today. We acknowledge all of you and we welcome you. Your Excellency, having finished with introductory formalities, I want to respectfully welcome the Honorable Commissioner in charge of the Ministry of Health to come for the welcome address at this event, Professor Augustine Umo. Please, can we celebrate him for the welcome address?
Your Excellency, the Governor of Akwa Ibom State, the health-loving Governor of Adia State, Pastor Umo Eno. Your Excellency, the Deputy Governor of our state, the Director General of the National Health Insurance Agency here present, may I crave your indulgence to stand on the already established protocol at this event. It is my great privilege to stand here to welcome you to this epoch-making event. It is a thing of joy for me that at last we are here to kickstart this program. As I think about it, I realize that when we wake up every day, we start off the processes of looking for our daily bread. But often when we eventually get this bread and we portion it to different areas, we take it where we eat for transport and for everything, almost everybody, or at least most people, forget to make some proportion out for health. Because if you ask, most will tell you, no, I will not get ill by the grace of God. But we all do understand, as we usually say, that as God helps you, you help yourself. Health insurance helps us to consciously make this proportioning out for that particular day. Because oftentimes, even when we think we have planned, when that day eventually arrives, it meets many people completely taken unawares. Even in things that we ought to really know. A good example is the 9-month program we always go through, called pregnancy. You'll find out that even after going through for 9 months, when it arrives, most people are often taken virtually, completely off guard. And in taking a look at what we do to deal with this particular issue, we've seen that we ask ourselves sometimes, why do our women run into problem? Because I can tell you clearly, no doctor, no health worker wants his or her pregnant woman to run into problem. And then in looking into it, we come to see what we describe as a 3-delay model. Why do they not get to hospital? The first delay, taking decision to even get there. The second delay, even when you've decided to go, how do you get there? Transportation and all. And if you get there, do you really get help? The third delay, which is the facility itself, the health workers, and that being present. Take a look in our state. His Excellency, the Governor, has provided for us good facilities for us to be able to access health. You will also agree with me that Akwa Ibom State is one state that has very good transportation network. Today, we are here by the grace of His Excellency to also look at that first delay. Because one of the things that usually affects people's decision to get help is when the wherewithal is not there, when the money is not there. But with health insurance, and once we provide this for you, it means His Excellency has clearly provided for you all the ways to deal with all the delays that you can think about. And you have the capacity now to seek health. We started the journey for health insurance quite a while ago. Through the processes of even the conception, through the setting up different committees, through the enactment of the law, putting the law together, running it through House of Assembly, getting it assented to, forming the necessary bodies to be able to put this together, the insurance agency, and recently the board. My dear people of Akwa Ibom State, by the grace of His Excellency, here we are today, finally, at the end of one phase, which is the end of the phase of planning. We are now going to move into the phase of execution of health insurance in Akwa Ibom State. Considering the political will that we have received to be able to get this together, considering also what His Excellency has done and through the ARISE agenda, we have very happily tagged what we are going to present today as the ARISECare. Now let us be clear. ARISECare has different aspects of it. The chairman of the agency shall be here to give you a little more elaborate explanation on these areas. But health insurance, as we shall provide for you, shall include both the ARISECare, which we are launching today, and other aspects of care. What do we want from Akwa Ibom people at this point? All we want is your participation. You will need to participate. We'll have insurance for the formal sector, we will have for the vulnerable, we'll have for families, we'll have, so that any day you fall ill, you can step to an accredited facility and be able to receive help. We want your participation. Please ask, register, because even if you get to a facility, if you are not registered, you will be unable to get help. Just like you have to subscribe even to your phones and others. Participate, register, and on that day, even at times of the unforeseen circumstance, you'll be attended to. That is what His Excellency promises you, and that is what the ARISECare promises you. As the Ministry of Health, we promise you to do our best to work with the agency to provide this care. We know we are starting a journey. We know there might be challenges, but be rest assured that we are ready to take on any challenges to be able to get the care going. I thank you for coming, and I welcome you to this occasion. God bless you.
We thank you to the Commissioner for Health, Professor Augustine Vincent Tumor. Your Excellency, moving on to present a brief overview of the Akwa Ibom State Health Insurance Scheme, may I invite the SSA to the Governor on Health Insurance, Dr. Edika Nekwere, who's also the chairman of the State Insurance Agency, to present a brief overview of ARISECare.
Your Excellency, the Executive Governor of Akwa Ibom State, the father of all Akwa Ibomites, Pastor Umo Baseno, Her Excellency, the Deputy Governor of Akwa Ibom State, Senator Dr. Akon Eyari, the Speaker of the State House of Assembly, Honorable Elder Udemoto, and the Honorable Chief Judge of the State, Honorable Ekaite Obot. Let me hide under the protocol. Let me stand on the protocol that has already been established and go straight to the overview of ARISECare. You're all welcome. So as a background, the Akwa Ibom State Health Insurance Agency is a corporate body established by CAP number 12, Laws of Akwa Ibom State of the House of Assembly, 2021 by the government of Akwa Ibom State to improve health of all residents at an affordable cost. Since health insurance is a social security system that guarantees the provision of needed health services to persons on the payment of token contributions at regular intervals, His Excellency the Governor had in his wisdom envisioned an Akwa Ibom whose citizens, unburdened by the shackles of the out-of-pocket expenditure, can walk into a health facility and receive quality care without spending a kobo. His Excellency did not only envision, he also voiced his commitment to ensuring that neither the rich or poor becomes impoverished by the medical catastrophe due to the burden of funding. Health insurance was a cardinal government's objective as clearly espoused by the ARISE agenda of the governor. To demonstrate commitment to his vision, the governor magnanimously constituted the board of the Akwa Ibom State Health Insurance Agency to direct and facilitate the smooth and quick start-off of the schemes on the 2nd of July, 2024. Sequel to the inauguration, the board swung into action in readiness to promptly deliver and provide accessible, affordable, and unrivaled health care to the teeming populace as soon as the schemes are launched by His Excellency, the Governor, today. The activities of the agency so far, I don't want to really go there for the sake of time, but I just want you to know that our Governor, prior to the following inauguration of the board, had paid a counterpart funding of 100 million naira to draw down the Basic Healthcare Provision Fund, which is a fund that takes care of the very vulnerable people, which are the pregnant women, the disabled people, the elderly people under 5, and other people that are captured under the vulnerable people. So, we continued our enrollment drive, pushing through to the organized private sector, which forms part of the formal sector. I also want to tell you that since after the inauguration, we have enrolled about 11,000 people under the Basic Healthcare Provision Fund in the last 1 month. So we are hoping to do more after this. And we have gone to several primary healthcare centers, and we went to 100 in the state across all the 3 senatorial districts, and 80 passed the accreditation test. So we will go back and accredit more as we go on to provide care for these people. So the enrollment drive was done, and this was done in partnership with USAID through AQs, ably piloted by one of our very pragmatic board members, Dr. Andy Ayo as the CEO, who ensured the enrollment of about 1,700 of his staff. He deserves a salutation for his patriotism. As I look around, I know that some of our revered corporate titans will make positive pronouncements concerning the enrollment of their company staff in this program. MDs and CEOs can pay at the rate of 18,000 naira per person, just the sum of 18 million naira to cover for the most basic package for 1,000 members of staff, or choose to do the corporate family package of about 96,000 naira for a family of 6, that's father, mother, and 4 children. So we can opt for that. Of course, if your staff strength is less, your enrollment premium will be less. So similarly, our community and political leaders can enroll families in their community. An example has been set this morning by one young man who inspires a lot of us by his singular commitment to the ARISE agenda of the governor. He called me this morning to say, Chairman, we have to support His Excellency's vision, support the agency, and empower our people in the rural areas through provision of healthcare. So even though I am not physically present, I will pay to enroll 25 persons from each of the 10 villages in my ward, totaling 250 persons from my ward. This is effective immediately, so you can send your staff to my community to start enrollments next week, Monday. I will also speak to some of my friends to enroll people from their communities. Please, your agency must not fail. We must do everything to protect His Excellency's vision. We have to play our part in helping the governor bed changes in the health sector. Insurance coverage as a tool that spreads financial risks associated with health spending, equal to uncertainty and unpredictable medical expenses, is high. So this young man told me all this. I was touched. That young man is my friend and brother. He's not here today due to very dire circumstances beyond anybody's control. And he asked me not to mention his name, but I will inform Your Excellency the Governor in private, because that is a demonstration of the commitment to service, the kind all political appointees to the governor should show. Therefore, I humbly call on our appointed and elected leaders, distinguished senators, members of the State's Executive Council, and honorable commissioners, community and religious opinion leaders to please partner with the agency to enroll their wards and families. This morning also, I put a call across to Right Honorable Polumete, who has decided to key into the vision of the governor by immediately enrolling 800 persons from his federal constituency at 200 persons per local government area across the 4 local government areas of Eket, Esreket, Ibnon, and Ona. on the ARISECare plan to cater to their health needs. I thank him specially, and I humbly invite other members of the National Assembly to join him in catering to the needs of their constituents. I also plead with Mr. Speaker and the House of Assembly to jointly register 26,000 Akwa Ibomites at 1,000 persons per state constituency. This we can discuss and work out the modalities. I trust, Mr. Speaker, that under your leadership, the State Assembly will rise to support our governor's ARISE agenda on health. The agency also met with the leadership of the organized sector, organized labor, who did not only affirm their readiness and willingness to be onboarded, but transmitted a correspondence to this effect through a memo to the head of civil service. Today's launch shall herald more multiple practical benefits of the schemes and allow for proper takeoff. We are poised to immediately commence enrollments of over 52,000 civil servants, in addition to the already captured 1,700 people under the formal sector plan. The continuous massive enrollments program also covers for the informal sector, where we have registered about 3,000 people from a group of transporters and market women, which are awaiting empanelment in the soonest possible time. We have in the past week successfully trained the providers at the primary health centers with a view to paying capitation and subsequent provision of health care soon. So to the ARISECare scheme is designed to advance the health and well-being of the people of Akwa Ibom State by providing comprehensive health insurance coverage as a tool that spreads financial risks associated with health spending. Number one, the scheme is structured into 3 distinct plans. Number one is the formal sector plan. This plan will cater for civil servants, public sector employees, and the organized private sector workers in the state. By mandating health insurance for employees, it ensures that the formal labor force has access to quality health care services, thereby reducing the financial burden of medical expenses on individuals and families. The plan will be supported by regular premium contributions from both employees and the employers. Number 2 is the informal sector plan. Recognizing that a significant portion of the state's population, that's over 80%, is engaged in informal economic activities, this plan provides a flexible payment structure to accommodate artisans, traders, farmers, and other self-employed individuals. Contributions will be tailored to the earnings of enrollees, ensuring affordability while providing essential health coverage for this vital group. Your Excellency, one place which has always posed a challenge in health insurance schemes across the nation is the informal sector, made up of traders, artisans, etc. Our strategy is to seek a grant to enroll them and have them benefit from health care for the first year. After that, we can use the data we would have mind to follow up their continuous enrollment. Your Excellency, like Oliver Twist, we like to appeal for a special grant to enroll under the ARISECare 8,000 market traders, women and men, 6,000 keke and minibus transporters, 3,000 mechanics, and 3,000 of other artisans, vulcanizers, tailors, etc. Your Excellency, sir, for these particular enrollees, our plan is to place a signage with the inscription, ARISECare beneficiary, at their workshops and market stalls. Number 3 is the Vulnerable People Scheme. This component of the ARISECare is specifically designed to ensure that the most vulnerable members of the society, including the elderly, pregnant women, persons with disabilities, and indigent individuals, are not left behind. The Vulnerable People Scheme will be funded through government subsidies, like the Basic Healthcare Provision Fund, and contributions from donors and development partners, ensuring equitable access to healthcare for those who are financially disadvantaged. So the implementation strategy, I won't go into that, but what we offer for the formal sector is that 18,000 naira can be paid for the individual persons to be onboarded in our scheme. This 18,000 naira is for 1 year. You don't need to pay anything when you get to the hospital. This takes care of the card fees, the investigations, the basic medications like antihypertensives, anti-diabetics, antibiotics, pain relievers. All those things are captured here. For those that do not have the expected care in the primary health care center, they will be referred to secondary health facilities where they will receive care, and then to tertiary center. For want of time, the informal sector, that's the gift ship, the group, the individual, and families. The groups will pay about 17,000 naira. The families will pay just 16,000 naira per head, which amounts to 96,000 naira, with some discounts that His Excellency said we should make. We have made these discounts, and we are confident that this will suffice. Then the benefits, I've already said that. Let me conclude by saying that our prayers were enormous, Your Excellency. Many of our prayers has been answered, but we wish every one of it could be answered to enhance a possible hitch-free actualization of our set goals within acceptable record time. We did request your esteemed presence as the chief host of this occasion to perform the launch of this scheme, ARISECare, which you have graciously granted. Thank you, Your Excellency. We are now requesting your benevolent pronouncement for the release of the equity fund for the schemes as stated in the law establishing the agency, a grant for the enrollment of 20,000 people, and an executive order to mandate this scheme as compulsory, sir. Thank you very much. Akwa Ibomites, Ufo Ibom Fon Ato. Thank you and welcome to this event.
Thank you so much. Please, can we celebrate that gentleman one more time? Very detailed address, showing there that this idea is well thought out and the strategy is very clearly defined. Your Excellency, the next item on our program will be to receive some messages of goodwill from some of our leaders, stakeholders, and partners who are here. By my list, I have about 6 persons who are supposed to speak, but I've been given about 8 minutes to complete all of that. Now, the implication of that is that I intend to take all 6, but if my time is exhausted, I will stop where my time ends. Please, please, strive to stay within 1 or 2 inelastic minutes so we can have an opportunity to hear from everyone. But let me put on cue that His Excellency's special guests, who has come all the way from the United States of America, the Mayor and Council President of the Upper City of Arlington, will be speaking last in this series of goodwill messages. We want to hear your voice from that part of the world. But let me begin today with the CMD of the University of Uyo Teaching Hospital for his goodwill messages. That's the gentleman that understands what we are doing here. Please, can we celebrate Professor Emema Basi. For emphasis, please, let's stay within 2 inelastic minutes. Thank you.
Your Excellency, sir, please permit me to stand on existing protocols. I would say that about 40% of the patients we see at the University of Uyo Teaching Hospital cannot afford to pay their bills. And that's a reality. And earlier this morning, I hosted the DG, and we signed a program that would start providing some funding, for the maternity cases. So I want to thank you especially for this program. It's a game changer. We can begin to provide the needed care. And I would say that 10 years ago, the then EXCO, which I was a member, attempted to do this. But because of the change in government, it did not come. So thank you very much for this. Thank you for all you do for Akwa Ibom people. Thank you for carrying us along, and God bless you, sir. Thank you.
That's an excellent example of how to use 1 minute. Thank you so much. Thank you so much. The statistics just rolled out are not fake. Of course, listening to a man who is in charge of University of Youth Teaching Hospital would reveal to you that that has real element of fact. Your Excellency, second gentleman to speak in this series of Goodwill messages will be Dr. Andy Ayo, the CEO of Issues. Please can we celebrate him also as he comes. This one never talks for long. I know he would use less than 30 seconds. Can we keep celebrating him? Thank you so much.
Thank you so much, Your Excellency. Our dear Governor, I have the privilege to read a speech from the Mission Director of USAID, just a very short one, Melissa Jones. She had wished to be here, and I'll just take a few lines of it. And it says, on behalf of the United States Agency for International Development, USAID, I extend our warmest regards and congratulations to Akwa Ibom State Government on this significant milestone. And this initiative demonstrates only the government's commitment to improving the well-being of our citizens, and is a clear understanding of sustainable development. At USAID, we understand that the success of any healthcare system depends on collaborative partnership. And over the years, we've worked closely with the State Ministry of Health through our partners and to strengthen health systems and improve maternal and child health. And today, we renew our commitment to continue working with you, sir, and side by side on a long term to ensure sustainable success of this health insurance scheme. As a demonstration of this commitment, we've given our partner, ECUS, the concurrence to enroll 1,591 of our ad hoc staff. And we applaud your visionary leadership of Akwa Ibom State for embracing innovation and inclusivity by ensuring that vulnerable populations, including women, children, and the elderly, are not left behind. The health insurance scheme is a bold step towards reducing the financial barriers that often prevent access to care. And in conclusion, we once again congratulate His Excellency, and as CEO of ECUS, we give our commitment to support the state government. Congratulations, sir.
We thank you, Dr. Andy Ayo. Your Excellency, the next to speak is the Chairman Forum of CEOs of State Health Insurance. May I invite Chief Godwin Iyala.
Good afternoon, Your Excellency. My name is Chief Godwin Iyala. I speak as the CEO of Cross River State Health Insurance Agency and the Forum of Chief Executives. Let me especially thank you for this major milestone you have taken today. You can testify from the way the people received you. Health is wealth, and the health of the people is the wealth of the people. Today, you have added more wealth to the people of Akwa Ibom State by the launch of this health insurance. When Dr. Ibemi was appointed, his name was placed on our platform. I placed a call to him, said, come over, I'm ready to assist. And they have been coming to understudy us. Even 2 weeks ago, when I was leaving to bury my mother, he called me to say they are coming. I posed for 1 day, come and study us. I'm happy to say that we are partners in progress. In the Forum of CEOs, we share ideas and help those who are coming up to catch up. From what I have seen in you, sir, Akwa Ibom Health Insurance will soon surpass other states. There are two things I will say. As you embrace the supply side, which is the health insurance, the demand side, which is the health insurance, you are equally going to embrace the supply side, which is going to deliver the services. If they enroll all Akwa Ibomites and the supply side is not available to offer services, it will suffer. And from what I have seen, sir, heaven will help you as you do this. Sir, I would like to talk to the legislators and advise them too that every funding that has to do with health insurance should be placed on first-line charge, away from bureaucracy. And to advise them too, like somebody has said here, that the adoption method should be sacrosanct and even embedded in your law to ensure that Even the constituency project which you embark on, attach more of it to the health. It is something that is like El Dorado. I urge Akwa Ibom State, please continue on this. The Forum of CEOs will always support Akwa Ibom State to ensure that they succeed and enthrone universal health coverage. Nigeria Health Insurance Agency, the DG is here, have been piloting us, they mean well for us, and if you are ready, they make you to succeed. His presence here has confirmed that. Thank you very much, Your Excellency, as you go on this journey. Thank you.
We thank you too, sir. Your Excellency, ladies and gentlemen, may I now invite the chairman of the Nigerian Medical Association of Akwa Ibom State, Dr. Enyekan Peters, for his goodwill message.
Your Excellency, the good and loving governor of Akwa Ibom State, we want to congratulate you and all Akwa Ibomites on our 37th anniversary. And this is a very good way to celebrate when you can give free and compulsory health to the vulnerable and other members of the state. And as partners, the Nigerian Medical Association would partner with you all the way in ensuring that this is a huge success. We are happy on the numerous appointments you've made in the health sector and all the health centers you've built. And we do know you're going to do more. Because since you came into office, you've seen that you are a people-centric governor who cares more about the people. And our good God will continue to bless you. And we want to assure you that the Nigerian Medical Association will continue to work and ensure in terms of monitoring, in terms of research and partnership, to ensure that all your programs are success. I want to beg you to get more hands, especially the healthcare professional on board in the Ministry of Health, and this will really help. All doctors are going to gather in Akwa Ibom State in October this year, and the national president of NMA will be giving you award of excellence. This shows the good work you are doing in this state, and we will stand together and partner with this board to ensure that it succeeds. Thank you so much for this opportunity, and may God bless Akwa Ibom State.
Please, can we celebrate the chairman of the Nigerian Medical Association, Akwa Ibom State? Thank you so much. Words of commitment and commendation for the good works of His Excellency, the Governor of Akwa Ibom State. Your Excellency, while the chairman of the Health Insurance Agency was speaking, Dr. Edika Nekwere, he made some requests from some quarters. I'm going to invite now the chairman of Algon, Akwa Ibom State, who will come to be the first to answer to one of those requests made by the chairman. Please, can we celebrate Honorable Nyobong Robson, Chairman Algon, Akwa Ibom State? Of course, you will be happy to hear from him.
Your Excellency, our very dear Governor, ladies and gentlemen. Your Excellency, it is a generally acceptable fact that one of the most essence of government is to secure lives and properties. And I can't really place a finger on any other thing that could secure life better than good health. As someone who has served at the local government level for quite some time now, I stand here to say that one of the greatest challenges we faced is a health challenge. A greater number of our people in the rural area are not able to afford, healthcare. So this is a very wonderful opportunity for us to help our people. I will not only thank you, Your Excellency, but I stand here to say that we have already discussed amongst ourselves, the 31 local government chairmen, and we've accepted to key into this program by way of ensuring that we will register at least 1,000 persons per local government council. That will make 31,000 across the state. And as an individual, Your Excellency, I will also register 1,000 people in my own local government. Thank you, and God bless you, Your Excellency.
Thank you so much. Please, can I ask for a better round of applause? Can I ask that we do it better? Celebrate this initiative, celebrate that noble partnership. Thank you so much. Your Excellency, before I invite the last speaker, this series of Goodwill messages, let me take our time to acknowledge some strategic partners. Zenith Bank, Algon, USAID, USUS, Primary Healthcare Development Agency, Heartland Alliance, and all the others who are here. Please, we acknowledge and celebrate you. The next and last person who shall speak, please, Your Excellency, CCC Arin. I think that's the one I skipped. We acknowledge you also, and we appreciate you for being here. The last person who shall be speaking in this series of Goodwill messages is our daughter, one that we're very proud of, one who is making Akwa Ibom State proud outside the shores of Akwa Ibom State. Here in Akwa Ibom, a special invitation of His Excellency the Governor, not just as our daughter, but in her official capacity as the Mayor, Council President of the city of Upper Arlington. Now, if you know His Excellency the Governor, you would know that this is not a fluke. One thing that we know about him is that he is permanently in the business of celebrating Akwa Ibom sons and daughters who are doing well in any sphere of endeavor. He wouldn't pass a star who has an Akwa Ibom name. I want to please invite all of us who are in this auditorium to put our hands together, please, and welcome. Can we celebrate her, Mayor, Council President, City of Upper Arlington, all the way from the United States of America. I don't think we're celebrating well. Ukeme Awage Sienjeta, we celebrate and welcome you.
Akwa Ibom Isango. Ah, that's a beautiful greeting, Your Excellency. Thank you. Thank you for having me. And today I congratulate and celebrate you on a vision executed. Many leaders have visions, very few execute. And as an elected official, I know how complicated health insurance is. The first universal health insurance in the United States was put in place by Lyndon B. Johnson, the 36th President of the United States, and that was in 1963. But what he could do was just the vulnerable population with a universal health care that we call Medicare and Medicaid for the older generation and the vulnerable. It would take 40 years from that for the 44th president, President Barack Obama, to institute universal health care for everyone. So what you have been able to accomplish in 2 years is just a testament to remarkable leadership, strategic partners, and a beautiful collaboration. And so I celebrate you, and I congratulate every Akwa Ibomite that will benefit from universal health care, because as someone said earlier, health is wealth. But I also know in running a city that a healthy people are productive people. And so I celebrate you all on the productivity that you will have from being a healthy people. Congratulations.
Please, can we celebrate her some more? Thank you so much. Thank you so much. Health is wealth, agreed. And of course, we just had another twist to that a healthy population is a productive population. Your Excellency, we want to thank you, continue to thank you, as a matter of fact, for your good intentions for the people of Akwa Ibom State. At about now, we will now be hearing from the Director General of the National Health Insurance Authority. This is bringing a national impetus to what we're doing here in Akwa Ibom State. Please, can we celebrate Dr. Kelechi Obiri for his address at this event.
Your Excellency, the Executive Governor of Akwa Ibom State, Pastor Omo Obasieno. Good morning, and may I say Mesere. Please permit me to stand on the existing protocol that has already been established, as I know we're pressed for time. Well, first, I would say, for me personally, this is a homecoming, because I spent 6 years of my life in Akwa Ibom State as a student in Federal Government College, Ikotepene. And so I consider myself an adopted son of Akwa Ibom State, Your Excellency. So even though today I come representing the federal part of our government, it is to a state that has been home to me for many years, and a people I have a lot of affection for. And therefore, it gives me great pleasure today to be part of this epoch-making event, because this is a significant milestone in the quest for better healthcare. I'd like to especially thank His Excellency for exemplary leadership. Many people have mentioned this today, and I would just like to join them and say congratulations, Your Excellency. The Reverend Martin Luther King Jr. once said that of all forms of injustice, inequality in healthcare is the most inhumane, because it not only robs people of dignity, it also robs them of their humanity. And we know that there are very few things that plunge people into poverty like ill health. That's why in the NHIA, our focus has been on reducing what we call health poverty. And this comes in two ways. One, we know that most Nigerians pay out of pocket for healthcare. So what happens when you don't have a pocket? It means you can't afford healthcare. We also know that a lot of Nigerians, even though they pay out of pocket, they struggle under the cost of healthcare. And a lot of them are just one catastrophic illness away from being plunged back into poverty. So what we're witnessing here today is one of the strongest defenses any society can make to prevent people from plunging into health poverty. Because not only does it keep them alive, it also secures their health and their livelihood. Health is critical for poverty eradication, sustainable development, and it is akin to what the government of any country can do to ensure that its citizens have a good life and livelihood. And it is consistent with the Sustainable Development Goals. It was in this regard that when Akwa Ibom State finally set up ARISECare, I was quite overjoyed, because I know that even though it's one of the last states to actually formalize this program, we have saved our best for last. And I have no doubt that Akwa Ibom State will become a reference point for many other states as they embark upon this journey. The NHIA has set 4 strategic goals. These are in line with the President's agenda for universal healthcare coverage and the Health Sector Renewal Investment Initiative led by the Coordinating Minister for Health and Social Welfare. We focus on 4 things. One is expanding coverage. As of December 2023, roughly 16 million Nigerians were covered by a form of health insurance. That number has grown to about 18.7 million, and we're looking at that number hitting 20 million before this time next year. For that to happen, we are empowered by the NHIA Act that has finally made it mandatory for all Nigerians to be covered by health insurance. And that means that it's important that this initiative is taken upon by everyone in society, both the formal sector and the informal sector. The second goal we established is that of equity, because we recognize that it's not just enough for those in formal sector and those who are well off in society to be financially protected, but it's also important for us to look after the poor and the vulnerable. This is why the NHIA works very closely with the state health insurance agencies through the Basic Healthcare Provision Fund to ensure that the extreme poor, the vulnerable, the disabled, The elderly are all covered. And that's why today it was with great joy that we worked with the University of Uyo Teaching Hospital to launch a maternal mortality reduction program where we provide financial access for every poor woman who requires emergency obstetric care. That financial barriers should not be the reason why someone should die while giving life. And we look forward to such collaborations. The third goal is that of quality. A previous speaker talked about this demand side and the supply side. And we are happy to partner with the State Health Insurance Agency in accrediting more facilities so that when people are insured and show up, it means that that trust is not broken because they go there and they receive good quality care. And finally, we recognize that it's a mixed healthcare system we have. So NHI remains committed to supporting the Akwa Ibom State Health Insurance Agency, supporting ARISECare through effective regulation, through mentoring, through coaching, and whatever you need. We stand with you side by side to ensure that the beginning of this journey, we follow you through to the end, to a point where we shall all look back and find and say that today was indeed a seminal day in the history of Akwa Ibom State. So finally, Your Excellency, distinguished ladies and gentlemen, I would just like to congratulate you once more for this very important step and really look forward to witnessing the successful strides that you will make as this journey continues. Thank you very much once again, and I look forward to working with you as we go along. And I bring the regards of all my colleagues from the NHIA who are here today. Please wave your hands. So we brought a delegation just to show you and to signal our commitment to Akwa Ibom State. Thank you very much.
Thank you so much, the Director General of the National Health Insurance Authority. We appreciate you for those glowing tribute and remarks towards the governor and the government of Akwa Ibom State. Thank you so much. Your Excellency, we're nearing the end, but immediately after the vote of thanks, which will be taken by the Executive Secretary of the Akwa Ibom State Health Insurance Agency, we're going to hear from the leader and governor that so many of us have said so many amazing things about. Immediately after His Excellency speaks, of course, we're going to present some token of identities to some vulnerable people who have already been identified for the health insurance scheme, after which, of course, His Excellency will be officially enrolled, which will mark the official launch of this scheme. Your Excellency, having said all of that, which is to cue us for what is to come, I shall now invite the Executive Secretary of the Akwa Ibom State Health Insurance Scheme, or agency rather. Please, can we put our hands together and welcome Dr. Igbemi for the vote of thanks. Under 1 minute, please. Thank you.
Your Excellency, our revered Governor and the Deputy Governor, please, I beg to adopt the already laid down protocols. It gives me a whole lot of pleasure to be here to undertake this laudable assignment. On behalf of the Chairman of the Board of Akwa Ibom State Health Insurance Agency, the members of the board, on behalf of the management team and the staff, I want to sincerely thank His Excellency for not just honoring us with his presence, but coming along with his full team. We're so proud to have you honor us, Your Excellency. I also want to thank the Director General of NHI. You didn't just come here alone. You came with your own team just to show the level of support that you're prepared to offer us. Thank you very much. Your Excellency, I want to ask that you permit me to recognize and thank some persons who stood by us the former governor of the state who gave assent to that law, the speaker who pushed forward that law, the Honorable Commissioner and his team. It's a job that was done by a whole lot of people. So I'm thanking them. I also want to thank the PPG, who doubles as the SSA to the governor on medical. Though not here, he played a very critical role in facilitating connectivity. I want to thank the civil servant of Akwa Ibom State, the NLC, who had been able to move them and coordinate them to demonstrate their willingness to join the scheme. Your Excellency, permit me also to thank the head of service and the former Commissioner for Health, Dr. Dominic Ukwong. When we came on board, they were there to help us get the accommodation that we have now, and also to assemble the team. I want to thank you very much for putting up the board that is working, and want to specifically thank the launch committee for helping us organize this wonderful event. Again, I want to thank the media. I want also to thank the protocol and the honor of this place for marketing Akwa Ibom State. Our partners that came in, they saw this environment already. Your Excellency, we can tell you that tourism has started. They're actually taking contacts. So I want to thank Akwa Ibomites, particularly the honor of this place, for giving us such an edifice that is unparalleled. I want to thank the partners that we have here, the AQs that have been mentioned, the LHSS, who have been here and who have really helped us with the enrollment. I want to I deeply appreciate the leader of the women group, the board member. We have heard that the informal sector is a challenge. She has gone ahead and she's mobilizing. We will key in. Finally, I want to thank Your Excellency for entrusting us with this responsibility to drive universal health coverage. I want to assure you that we will drive implementation. We will enroll more people. We will deliver results. We will make you and the Akwa Ibom State and Akwa Ibom people proud. For everyone that has made up time to be here, please thank you very much. We appreciate your presence. We appreciate your patience. We appreciate your kindness. This is a Akwa Ibom project, and we will get it done. Finally, to God be the glory. The Lord of hosts deserves this praise, for he has given us the strength, the wisdom, and we all owe him this appreciation. Thank you. Thank you so much.
Thank you so much. Thank you so much. Thank you so much. On a day as today, when there are so many people to be appreciated, we remember the advice of a wise man who once said, there are so many people to be appreciated with just the word thank you. Perhaps you could just add many S in front of it and just declare thank you. So please, just pick your share and let it pass. We truly do appreciate all of you. Your Excellency, the Governor of Akwa Ibom State, distinguished guests, ladies and gentlemen, a lot of things has been said today. The CMD of UUTS, it was who reminded us that about 10 years ago, this was attempted. It took another 10 years for this to become a reality. We want to invite now the governor who turns ideas to reality. a governor who loves Akwa Ibom people without a doubt. Please, can we celebrate His Excellency, Pastor Omoino, Governor of Akwa Ibom State, as he comes for his remarks and address at this event, after which he will officially launch the ARISECare.
Thank you so much. Akwa Ibom is song. Please, let's take our seats. Thank you so much. Thank you so much. Your Excellency, the Deputy Governor of Akwa Ibom State, the Chairman of our party, the PDP in Akwa Ibom State, and the ESCO of our party, members of the National Assembly that have joined us here, the Secretary to Government, the Head of the Civil Service, Honorable Commissioners, Honorary Special Advisors that have joined us here, our very special guest to Akwa Ibom, our daughter, the Mayor and Council President of Upper Arlington Council in Ohio, United States of America, Mayor Keme Awaresien Jetta, that is here with us. Thank you for accepting our invitation to celebrate our 37th anniversary with us. We celebrate you, and I know I'll take you up when at our anniversary dinner, you'll be speaking to us in our local dialect, you know. And thank you, Mr. President of Akisan, for flying all the way, and all of your entourage that have been here with us. The Director General of the National Health Insurance Agency, Dr. Kelechi, we salute you. The wife of the former governor, service commanders that have joined us here this afternoon, captains of industries, distinguished partners that are here with us, chairmen of boards and commissions, especially the chairman of the Akwa Ibom State Health Insurance Agency and all of your staff, the chairman forum of CEOs of state health insurance agencies, permanent secretaries, heads of extra-ministerial departments, chairman of local government transition committee led by the Algon chairman. I hope you are campaigning all around the local government, because we must win this election. We have what to campaign on, and when you have what to campaign on, you don't struggle. And so please campaign on the successes we have recorded, and Akwa Ibomites are prepared to say yes. So we must go out there and work. I welcome you. The CMD of UUTH, my grandson, and proudly so. You know, when you do well, everybody identifies with you. You're doing extremely well. And the president and members of different medical associations, the chairman of NMA is here, the organized labor, sociocultural groups, beneficiaries of the Basic Healthcare Provision Fund, invited guests, men, women, our youths that have joined us today, the female youths, purple, lemon, ladies in white, and all of the other groups, members of the Fourth Estate of the Realm. Ladies and gentlemen, I am actually very happy to be here this afternoon at the official launch of this healthcare insurance. Today represents a very significant moment since you entrusted me with the leadership of our dear state. Healthcare delivery is one of the critical pillars, indeed a positive right that is embedded in the principles of the social contract in the ARISE agenda. In the course of my electioneering campaign for this office, I had made a solemn pledge that if elected, will implement this program, which also speaks to our commitment to the well-being of our people, particularly in the rural areas, especially those at the bottom pole of the human condition. And so today, as we gear up to celebrate our 37 years of glorious existence as a state, let me congratulate Akwa Ibom people for being one of the states in the nation to have a health insurance scheme. Let me thank the chairman of this agency, Dr. Akwa, and his team for rising to the expectations we have for this agency. Thank you for the many meetings we have had together, severally in my office. Thank you for taking up the challenges. I thank the Honorable Commissioner for Health, Professor Augustine Umor, for your leadership in this scheme. Thank you for the many text messages and all of the talks we have had to get this working. Is worth the while, and I want to thank you. I want to thank you for not giving up. I have always known that where there is a will, there will always be a way. And so I'd like to thank you. It is a known fact that health is wealth, and that has been repeated here severally. A healthy population, of course, like the President said, is a productive population. That explains why healthcare delivery is key and it's a focal point of our RISE agenda. If you ever have to pay for health services out of pocket, if you are away from this country, you will appreciate what is going on right now, that we must have our own healthcare insurance scheme. And one of the very few projects I flagged off at my inauguration was the Model Healthcare Center in Ibesikpo local government area. We've done several things and work to support our health system in this state. We will continue to do so. I believe that even before food security is health security, because if you are not healthy, you really don't want to eat any food. You can imagine, for those of us who are prone to malaria, every time you have malaria attack, no matter the food that is presented before you, you wouldn't really want to eat. So we thank God for all the work that everyone is putting in to make us have this healthcare delivery system. We will continue to support our healthcare services in this state. Recently, we ordered ambulances. 6 of them have been delivered, and we want to complement this insurance scheme with a robust ambulance services. Of course, in the past, it couldn't work because when you pick people and take them to the hospital, the question was who will pay. But right now, when we pick people that have this insurance scheme and beneficiaries, we know which hospital to take them, so it will make it work. I've just asked my PPG that 6 is not enough. We must increase it to 10 so that each federal constituency can have that ambulance that will just be some minutes away from you. Because of the health insurance scheme, we'll give everything we can to support our people. Every now and then, people fall ill. I know how much we've had to spend. We'd rather spend that giving them health insurance covers so that they can have access to medical care. We also want the agency to please help us by publishing the list of accredited primary health care centers that our people can access. But let me also say that my major concern now, I've discussed it with you in our several meetings, is how we get medications. And this, we've been trying to talk. The Honorable Commissioner will remember we've had this discussion. We want to see a robust pharmaceutical services that when people turn up in these hospitals, we don't hear stories like no drugs, no drugs. I believe that we can electronically work with you and make sure that there are medications in our primary health care centers. I believe we can do that. This will add impetus to what we're about to do. And once we have that presentation and we're satisfied, even while campaigning, I had challenged the pharmacists to let's work together. So where you can have the head in Uyo, but he or she can tell us what medication is available in the primary health care center in my village and know when to move. Maybe they need some medicines in another primary health care center. It's just like running a bank treasury. A bank manager will understand where there is fund and when to move to the next branch if there is a demand. This will really, really help us. And so it's not just giving people covers and giving them papers to hold. All of us have a duty, whether you are a doctor, you're a pharmacist, to ensure that this works. This works, and we really like to see that happen. So there's much more work at each step. And we'd like to tell our contractors, I'm sure in the coming days, my senior special assistant on legal documentation will be working with the House of Assembly to ensure that all our contractors in our state will have insurance covers for all their staffs. We must ensure that that happens. And then everyone doing business in Akwa Ibom, this will seamlessly just move because we don't want to expose our people to unnecessary risk anymore. With 18,000 naira, for all of the things that I have seen listed here, 18,000 naira a year, you can do antenatal, deliveries, obstetrics, general surgeries, dental care, eye care, emergencies, laboratory tests, ultrasound scans, radiological interventions. I asked the chairman and the health commissioner, are we sure this is for 18,000? And they told me yes. So this is good business, and I like that we take advantage of this. We can all be happy, and as a government, one of the things I've said is that people have asked me, what will be your legacy? And I've always told them, the people will be my legacy, because we need to invest in our people. We need to invest in their well-being. We need to make sure that we have a strong people that will bequeath to the next generation. So we are prepared to do all we can. We remain dedicated to fulfilling our campaign promises as contained in our governance blueprint, the ARISE agenda. We'll continue to work with all of our elderly people. We'll continue to ensure that they have this access. Very soon, we will be flagging off our elderly center, where we'll also ensure that people from above the age of 65 will have access and will be able to put them on the insurance. Government will be responsible to be sure that they can have access to good Medicare. We're currently working, and I just whispered to the CMD of UUTH, that we need to work together. We have professionals in this state. There's no reason why Ibom Specialist Hospital should not be a standalone medical hospital that we can partner and ensure that we give our people the best healthcare facility. I've asked for a needs assessment to be conducted, and we really want to be sure that we have a facility that we can be proud of. Cost of Medicare outside Nigeria is extremely expensive. In these days of $1 being 1,650, you cannot but ensure that we put in our very best right here. I look forward to a day where that hospital will truly be what it was meant to be. My idea is that it must be a standalone hospital, must be separated from government. Government will invest in it, but make it standalone, have the right doctors, be able to partner with doctors across the world, begin to do telemedicine, and begin to do teleconsultation. And this is just the way to go, so that we don't have to every now and then be flying people out. Even the cost of air ambulance in itself, we can invest all of that. And I'm prepared to do so and many more by the grace of God. Let me say this very clearly to the chairman and all of the people in this agency. Make no mistake, please, this agency must continue to exude credibility and accountability. Make no mistake that you will be audited. I'm going to appoint one of the best auditing firms in this country and put them to monitor your work and to monitor the things you are doing. It may be a very unpopular decision, but make no mistake, read my lips today. I will audit and I will prosecute any act of fraud that I find in this system. I need to warn ahead of time. We are here to provide services for our people, and that we must do. And so let's don't take the funds that are being put in place for granted. Let's don't take it for granted at all. We must ensure that we use this fund, we run the agency, and make it extremely credible. We must make Akwa Ibom Health Insurance Agency a reference point for insurance agencies in this country. And let's approach it with all amount of seriousness. Let's see it as a call of duty, and let's see it as a call to duty and a service for our people. On that note, I've just conferred with the head of the civil service, and he has told me he has 9,150 junior level staff from levels 1 to 6, and by law they are supposed to pay 5% of their earnings to support this their health insurance. Being the first year and considering the very nature of the economy right now, I've undertaken to pay 180 million naira, covering all staffs, all civil servants from levels 1 to 6. Those are the junior cadre. We don't need to touch their money, at least for the first year. Let them enjoy it, and when they see that it works, they will willingly register for the next year. So your levels 1 to 6, 9,150 of them, the government will pay and deliver a check of 180 million naira to the agency to cover all of them. On that note, I wish to thank all of you and look forward to flagging off this scheme. Thank you so much, and God bless you.
Thank you so much, Your Excellency, the Governor of Akwa Ibom State. Thank you so much. Please, we can take our seats yet. His Excellency is announced. Please, let's take our seats while I invite the chairman to please come over, stand somewhere here with His Excellency and the Commissioner for Health. Your Excellency, some indigents of Akwa Ibom State have been identified, and we're going to present their identity cards to them, which shall be presented by you, Your Excellency, on behalf of all the others who have been enrolled in the scheme already. Your Excellency, please, the check, or the identity card rather, will be handed over to the chairman of the Health Insurance Agency, who would, of course, give to His Excellency when the names are mentioned. Just 5 of them, and we would conclude. Your Excellency, the first enrollee, I want to welcome Edmond Ekanem. Please, can we celebrate Edmond Ekanem as he comes through? Edmond Ekanem, please make sure it is the right identity card. Apologies, Your Excellency, please. Edmond Ekanem begins today to enjoy the perks of the health insurance scheme, ARISECare, courtesy His Excellency, the Governor of Akwa Ibom State, and of course the government of Akwa Ibom State. Thank you so much and congratulations. Your Excellency, next I want to welcome Imabong Imo. Imabong Imo to come next, please. Can we celebrate her? She also comes, the next enrollee in the scheme. Of course, the scheme also covers pregnant women, of course, counted as vulnerables. And Your Excellency, next I want to invite a set of twins who have also been enrolled in the scheme. Baby Angela, baby Confidence. Please, can we celebrate them as they come? These ones have been favored from birth by this initiative of the Akwa Ibom State government. Please, can we celebrate them? Can we celebrate them? Can we celebrate them? Baby Angela, baby Confidence. They're having a date with destiny right now. Beyond the health insurance scheme, I'm sure that their fortunes will also receive a smile from His Excellency, the Governor of Akwa Ibom State. Please, can we continue to celebrate them? Thank you so much, Your Excellency. Congratulations to baby Angela and baby Confidence. We appreciate them. And we congratulate them. The next two shall come will be Goodwill Asukwo Udo. Please just hold on with the Director of Protocol. Goodwill Asukwo Udo to please come through now. We have just one more, Your Excellency, after Goodwill Asukwo Udo. Mr. Goodwill Asukwo Udo, who's also an enrollee, receiving his identification card and becomes a beneficiary of this scheme beginning today. Your Excellency, the last but not the least, Tuba Donovi. Please, can we celebrate her? She comes forward to also receive her mark of identity from His Excellency, the Governor of Akwa Ibom State. We thank the government, we thank the Governor, we thank the agency, and we thank all the partners. We continue to appreciate you. Your Excellency, thank you very much. Those are the enrollees who now take His Excellency to be officially enrolled, and this will mark the official launch of this scheme, of course, and after that we would just take the national anthem and would end the event, trusting that the press will allow that to be effectively captured. The brass band, please continue. It's the official launch of the Akwa Ibom State Health Insurance Scheme tagged ARISECare. And we want to thank everyone who is here. And of course, special thanks to His Excellency, the Governor of Akwa Ibom State, who has made this a reality today. Congratulations, Your Excellency. And of course, congratulations to all the would-be beneficiaries of ARISECare. Your Excellency, we thank you and we celebrate all of us. Please, having come to the end of these engagements this afternoon, I will invite all of us to please rise as we end with the national anthem. The anthem, please. Thank you. Please, let's maintain some decorum. Let's stay where we are and allow His Excellency the Governor that we celebrate the honor of walking out of the auditorium before we disperse. Please allow him